Hello, hello, everyone, and welcome. I'm going to take up a few minutes while people are getting in and getting comfortable. I want to thank you for joining us for our webinar, Bridging the Gap, Supporting Loved Ones as They Wait for Mental Health Care. I am Susan Weinstein. I am Executive Director at Families for Depression Awareness. You should know we are recording this webinar and we'll post it on our YouTube channel, which is FFDA1, the number one. So you should have that available to you. You'll get a link as well. So housekeeping kind of stuff, with regard to Zoom, we invite you to use both the chat and the Q&A features. Please use the Q&A to direct questions to Dr. Kline or me, and use the chat to share ideas and insights with your fellow attendees. Families for Depression Awareness staff member will be providing links and information in the chat, so be sure to keep the chat open if you can. And chime in, you could say where you're coming from and whatever it is that helps you to feel involved. Wanted to thank the people who submitted questions with their registration. We've come through and we'll ask as many as we can. We welcome questions asked through the Q&A feature as well, anytime during the presentation, and we'll try to get answers on all that we can during the webinar. We've slotted 90 minutes for today's presentation and the Q&A. When you've finished or you're ready to leave, we ask that you take a few minutes to fill out our survey. We'll provide the link in the chat multiple times. It'll also be on the screen. But we want to know how the webinar was helpful and where we might make improvements. Your input helps us decide on the topics that we include in future programs, so feel free to write the things that are on your mind. We take your comments seriously, and we very much appreciate your time doing that. As a small incentive for you to complete the survey, we'll be sending a $15 Amazon gift card to one lucky person chosen at random from those who have completed the survey. We're going to send the gift card to someone, so you might as well increase your chances and give us a survey, because someone's gonna get it. Let's start off with a poll. The statement is, I have ideas for how to keep my loved one motivated for treatment while they are on a waiting list. Choose among strongly agree, neutral, disagree, or strongly disagree. We'll let that run for a couple of moments. And while you're all answering those things, then let me go ahead and go through the agenda. So here we are at introduction. I'll talk about Families for Depression Awareness briefly, and then I'll pass it over to our featured presenter, who will talk about understanding change motivation, motivational interviewing, tools for motivational interviewing, and maintaining momentum, which is so key. We'll switch over to questions and answers, and then we'll ask you once again to fill out the survey. So that's what you should expect. And as I said, we'll be here for about 90 minutes. Families for Depression Awareness is a national nonprofit organization. We help families recognize and cope with depression and bipolar disorder to get people well and prevent suicides. From our experience, we know that mood disorders affect a whole family beyond the genetic factors that can increase the likelihood of someone having depression or bipolar disorder. Family dynamics and our everyday lives could be disrupted. When someone is struggling, it does have an impact on people around them. And it's important to us that people know this so that everyone in the family can have their needs recognized, addressed, and they can get support. Our niche is that we offer education, resources, and strategies that are specifically for family caregivers. To us, family caregivers hold an important place in family wellness, but also suicide prevention. They're often the first to notice signs of a problem. They are highly motivated to act, and they're often positioned in a place to marshal the resources that are needed to get their loved one into care and on the path to mental wellness. Our website is at familyware.org, provides information, instruction, and inspiration. We've always relied on family stories, people sharing their personal experiences. We think that it's instructive and often inspiring and reassuring and can really help reduce a sense of loneliness that a lot of caregivers experience. You're not alone. There are people who can be there for you, and you can take some hope from what we have on our website. There's also a little QR code here now to sign up for our newsletter, and comes out monthly. Sometimes we have extra ones just to let you know when programs are happening, but you can find all kinds of things on our website, and often our newsletter will point you to significant resources. I will take a look at the results of the poll, which are that about 40% of you are neutral on whether you have ideas for how to keep your loved one motivated for treatment. Interestingly, agree and disagree are almost even, and strongly disagree is a little bit less than strongly agree. So it looks like Dr. Kline has opportunities to help people move up to closer to strongly agree. So there's the numbers if you need them. All right, now it is my pleasure, let me get this out of my way, to introduce you to Dr. Kline, who is our featured presenter, and I am so excited. I'm very enthusiastic about tonight's webinar, and I just feel like we're going to walk away from it with really concrete strategies and practical tools, and so I'm here for it. But let me tell you about Dr. Kline. Dr. Emily Kline is a clinical psychologist with nearly 20 years of experience working with individuals and families in community mental health settings. She's held faculty positions at Boston University and Harvard Medical School, and has led research studies focused on early course psychosis, adolescent and young adult mental health, and parent-focused interventions. She is the author of The School of Hard Talks: How to Have Real Conversations with Your Almost Grown Kids, and the creator of the School of Hard Talks Online. She's published dozens of articles appearing in a range of peer-reviewed scholarly journals, textbooks, and popular magazines, and she has spoken with audiences all over the world about mental health and communication. Dr. Kline completed her bachelor's degree at Haverford College, her master's and doctoral degrees at the University of Maryland, Baltimore County, and her clinical and postdoctoral training at the Harvard Medical School. Dr. Kline lives in Boston with her family. And now it is my pleasure to turn the program over to you, Dr. Kline. Thank you so much for being here.
All right, thank you. And I wrote down those numbers because I'm not doing research right now, but the statistics classes never leave you. So hopefully I will be able to help people feel more confident with some ideas of how they can help their loved ones stay motivated while they're on wait lists, which I know is a huge problem in our field. So I'm here tonight to talk to you about understanding why people change, what gets people motivated for change, and how you can help your loved one stay on that path. We're here tonight in the setting of depression, right? So we all know people with depression. And I want to say first off that I think depression does present really unique challenges for motivation. When we're depressed, we don't always think, gosh, I should talk to a therapist or take some medication to help me with this problem, right? We tend to think my house is a mess and my friends are not texting me back and my boss is a jerk, and I hate my clothes, right? I have nothing to wear. We don't right away think, oh, the problem is me and I have a negative outlook and something has changed, right? So it's hard to get that insight, first of all. And then the other piece is that the other hallmark symptoms of depression are hopelessness and helplessness, right? Which makes us feel like nothing's going to get better. And so there's no point trying anything new. And when people hear their loved ones say things like that, it's terrifying. And we think, oh gosh, this person is not motivated for treatment at all. And I just want to point out that when you hear those sentences or those expressions of hopelessness and helplessness and negativity, that is the depression. Like that shouldn't surprise you. If your loved one has a diagnosis of depression, they're probably thinking things like that, and they might say them out loud. And that is the diagnosis. That's what we call depression. So it's not surprising that they're feeling hopeless and helpless. Um, and it does make the road to treatment a little tougher, but not impossible. Um, so let's talk about some strategies to try and capture motivation and keep it higher. There's a lot of reasons other than the depression that people might not want treatment or that their motivation might wax and wane. So they may have had negative experiences with prior mental health providers or feel stigma. Like I have some patients who, um, their mom or their sister or their brother is very supportive of their treatment, but nobody tell dad, right? Because it's like there's a lot of stigma there. Um, they may feel overwhelmed by the process of finding a provider. Like I said, I know how bad the mental health system is. There really is no system, it's chaotic. And you're like, is this legitimate? I'm on some random person's website sending them a message. It doesn't feel good. There can be long wait lists. So, across lots of areas of medicine, but mental health has been bad lately. Um, it can be hard to deal with insurance, especially when you're feeling depressed and overwhelmed. Um, and then, of course, a lot of providers don't take insurance or they only take certain insurances, and the cost itself becomes a barrier too. You may also need a provider who has certain specialty expertise, and there's no one like that in your state or area, and that can be frustrating too. Um, But recognizing all this, we still want to try and help people work through those potential barriers or frustrations and stay motivated or at least curious about change. It can be really helpful to think of motivation not as sort of an on or off switch, something that's black or white, but instead think about these stages of change. And when I talk about these stages of change, I want you to almost think of a circle, or as one of my patients said to me last year, a spiral staircase, because people can cycle through these stages many times, right? So we talk about pre-contemplation, which is a nice kind of word for someone who does not want to change at all. Means they're not thinking about change yet. So they might say, no, there's nothing wrong with me. I don't want therapy. Therapy is, total garbage. It's not for me. That person is in pre-contemplation. They might be in contemplation, like, yeah, I've been Googling and I think I might have depression, and Google tells me I should see a doctor for that. Um, and that's as far as they're getting, right? They're not actually taking any steps, but they're thinking about it and they're starting to think hard about it. They may be in preparation, like not only am I Googling depression, but um, I am Googling, treatment for depression in Boston, treatment for depression in Missouri. Like, what can be done about this? Maybe starting to look up providers, maybe checking with their insurance company to see what's covered, maybe talking to a family member about, like, do you remember that doctor I talked to 5 years ago? Like, they were pretty nice. What was that person's name? Thinking about actually getting ready to make that change and taking some steps. Action means they're making changes, right? I called and I made my appointment. Um, or my appointment's tomorrow. So I'm calling out of work and making sure that I can get there on time and looking up the bus route, all that stuff. And then of course there's maintenance. So we need to maintain change over time. So you don't just go see your therapist once, maybe you see them every other week for 6 months or something like that. Um, or they're recommending that you get to the gym or that you take a medicine and you take it every day. And then, of course, there's relapse, and that can be part of the change process too, right? Testing. How valuable was that change? Is it something that I need to maintain forever, or can I stop? And I do think sometimes relapse is like testing, right? In research, we talk about ABA testing, like where you have a condition and then you apply treatment, then you take the treatment away to see was it working. So people are doing ABA testing on themselves, and relapse can be a part of that. So it doesn't mean it's not part of the change process. They may learn a lot from their relapse that, oh, that medicine really was helping me and I need to get back on it. Of course, as caregivers, which I assume most people on this call are caregivers, you want to help somebody move along the change process. So if they're in contemplation, you want to move them into contemplation. And if they're in contemplation, you want to move them into action. Um, and we have lots of tools to do that. But often the people who we're trying to help don't appreciate um, our input or our efforts to help them. So I want Susan's going to play a quick video about this, and apologies to anyone who's seen it before. I know there's some familiar faces on this, or familiar names on this call, but hopefully people will find this illustrative and it might feel familiar to some people. Oh, I can't hear that. I don't know if other people can. Um, Susan, you probably have to unmute yourself and share the sound.
It's just, there's all this pressure, you know? And sometimes it feels like it's right up on me and I can just feel it, like literally feel it in my head, and it's relentless. And I don't know if it's going to stop. I mean, that's the thing that scares me the most, is that I don't know if it's ever going to stop.
Yeah. Well, you do have a nail in your head.
It is not about the nail.
Are you sure? Because, I mean, I'll bet if we got that out of there.
Stop trying to fix it.
No, I'm not trying to fix it. I'm just pointing out that maybe the nail is causing.
You always do this. You always try to fix things when what I really need is for you to just listen.
See, I don't think that is what you need. I think what you need is to get the nail.
See?
Okay, fine. I will listen. Fine.
It's just, sometimes it's like there's this achy, I don't know what it is. And I'm not sleeping very well at all. And all my sweaters are snagged. I mean, all of them.
That sounds really hard.
It is. Thank you.
Oh, come on. If you would just
Don't.
try to see things now.
All right, so quick poll. I'm curious if people can relate to this situation. Oh, okay. So that's a overwhelming response. Most people are finding this is familiar. And if you want to drop in the chat, like what resonated with you about that, please. I'm sure people would love to see each other's responses. Um, so while people think about that, I want to introduce this concept from motivational interviewing of what we call the writing reflex. And when we see someone who we really care about and they have a problem, we want to help them with that problem. And the writing reflex is the impulse to help that person by doing one of these three things, either trying to fix their problem, like saying, okay, let me just pull that nail out for you. giving them advice. So saying, I think you should go look in the mirror and see if anything's different, or minimizing their issue. And that's definitely not what he was doing here. But sometimes we do this with our loved ones when they say, oh, I don't like the way that medicine made me feel. And we go, oh, I think you were just imagining that, or it's really not that big a deal. You just need to stay on it longer, or something like that, right? We say that's not really a problem. So we all have this good intention, but our writing reflex sometimes gets in the way of actually helping people make healthy changes. So I don't want to dwell too long tonight on like what not to do. I'd rather give you guys some ideas of what to do. But I start with the writing reflex because it's so important to recognize that and to get on top of your own writing reflex, so that you can be a more effective supporter of change in your loved one. So the tools I'm going to give you tonight are from a sort of communication practice called motivational interviewing. And motivational interviewing is a communication style that is widely used in the health professions, mostly psychology, but social workers, doctors, nurses sometimes also get trained in this. And it's a way to talk about making healthy changes. So it's not like a worksheet or a specific therapy. It's just a way of talking. And it was developed in the 1980s and 90s by psychologists who were working in addiction treatment, um, with highly ambivalent patients. So if you know anyone who's using drugs and alcohol, they're often very ambivalent. Part of them wants to change their behavior around those substances, but the bigger part of them might be fearful about doing that and might defend the current behavior and not want to change anything. So they developed this way of talking about change in order to try and get past those defenses, and have a more productive conversation about change and elicit the person's ambivalence so that they could talk about that ambivalence and talk about both sides, the part of them that really wants to change and the part of them that might be fearful. But the basic philosophy here is that the best way that we have to influence other people's behavior, whether those people are related to us or not, is really by giving them space and helping them explore their own motivations, rather than trying to like strong arm them. As a psychologist, I see my patients for like between 30 to maybe 50 minutes a week. And then they leave my office, right? So I don't have any control over what they do once they leave. So sometimes I find that when I acknowledge that, like, well, obviously it's up to you. I'm not going to follow you home. I don't know what you're going to do. You're going to make up your own mind. Just saying that creates so much breathing room for the person that they can actually sit and think about what they want to do. They are feeling really pushed around by people, and that makes it hard to think clearly. So the tools that I'm going to teach you tonight are tools from the motivational interviewing playbook. And you might want to try these with your loved one, if you're not sure how to start a conversation about change, or if you've tried other strategies like saying, okay, we're just doing this, or you can't stay in my house if you don't do this, or other things haven't worked as well as you hope they would. Nothing wrong with those other strategies, just if they haven't worked, this is something new you can try. You also can use these strategies whether or not your loved one is interested in change or on a wait list. They don't have to be on a wait list for this to work. And even if that person really seems stuck in pre-contemplation and they're not ready to make any concrete changes, you can use these strategies to work on improving the relationship, which might make them more receptive to your advice over time, right? If every conversation you have is adversarial and they're feeling judged, they're not going to accept your advice. So these are strategies to try and have a different kind of conversation. So here's the basic theory, and in social psychology, this is called self-determination theory. And motivational interviewing, there's somewhat different language. Here's the language I like to use because I think these are words that most families understand. So they're the ones that I like to use. which is that in order to consider a change, people really need to feel these three things. They need to feel understood and connected. Like the person I'm talking to gets me, values me, sees me as an individual with my own specific values and history and goals. They need to feel confident, like this change that this person is asking me to make is not impossible. I could do it. And also, when we're specifically talking about seeking treatment for depression, they also need to feel confident in the treatment, right? That the treatment would be helpful. So, confident in themselves, confident in the solution that it could help. And finally, they need to feel in control. And that's what I was saying a minute ago about, reminding people, I can't make you do this. This is up to you. I'm just here to talk it through. And often when a conversation has gone badly, a conversation about change, I like to ask myself, which of these three elements failed? Maybe all three of them, maybe there's one that stands out. But sometimes I realize, oh, I didn't really take the time to understand the other person's perspective. Or I thought that telling them, try going to sleep at the same time every night was like totally doable, but they didn't feel that way, obviously. Or maybe I was being too pushy and I wasn't reminding them that they're in control. So we want people to feel those three things so that they can think, so that they're not just pushing back against people pushing them, and just playing, what I call tug of war, which is like you expect me to say something, so you automatically argue against it, and like we're not having a genuine conversation. But really, we want people to feel understood, confident, and in control so that they can think and really use good judgment, think about their own goals and values, their own motivation, and make decisions from that healthier part of their mind, not the part that's feeling judged and defensive and saying there's no point, I don't want to, you're all judging me. That's sort of the unhealthier part of the mind. And those can both exist in the same person at the same time. But I want to give you some tools for helping people feel understood, confident, and in control that are very concrete and you can go home and use. So the first tool is called reflections. And I always start with this because it's so simple, but also not easy. The idea of reflection is to slow down and show that you are seeking to understand, really to create that space for understanding and also kind of convey autonomy because, as I'll show you in a minute, you're not going to be telling them what to do right away. So a reflection is a statement, not a question. So you want your voice to go down at the end of it. And it's specific. You can't just, the guy in the video did a reflection when he said, that must be really hard. And that might work once, like she said, oh yeah, it is. Like, thank you for noticing. But you can't just say that over and over again. You have to get a little more specific with your reflections if you want them to really land. And what you do is you repeat back what you heard the person say, or you take a guess at what they meant or what they're feeling. And the goal, as I said, is to slow down, to help the person feel understood and accepted, to tell your own writing reflex to like, chill, hang on, we're doing something else right now. And also, sometimes when people are saying things, people say lots of things they don't mean. They play tug of war, right? My husband says, hey, you should change the way you load the dishwasher. Those cups get kind of melty when you put them on the bottom. I might say something like, okay, fine, you do the dishes then, right? Because I don't like feeling criticized or being told that something I'm doing isn't good. But I don't really mean that, right? What I really probably mean like, oh yeah, you're right. I should do that. So when you use a reflection, you're giving people a chance to hear their own words back to them and think about whether they really meant that or whether they were just being defensive. Excuse me. So here's 3 types of reflections that you can try. The first is simple. Just repeat back what you heard, and I'll give you examples of what all these sound like in a minute. But a simple reflection really is just that simple. You repeat back what you heard. A complex reflection is when you try and reflect the gist or the overall meaning, and you might cue yourself up to do a complex reflection by saying, "It sounds like," or "if I'm hearing you correctly." And that kind of is like training wheels for doing a complex reflection, like you're reminding yourself that that's what you're about to say. But it's a good way to start. You can also try a feelings reflection, and that can be especially helpful when somebody's having big emotions or they're talking really fast and conveying a lot of information. And there's no way that you're going to reflect every point they made. That would, like they just talked uninterrupted for 10 minutes. You're not going to repeat all that back to them. You might just say something like, "Wow, that sounds like you're feeling really frustrated," or "feeling very overwhelmed," or sometimes when people are arguing against every suggestion I make, I say, "It sounds like you're feeling kind of hopeless." And that can really change the direction of the conversation. The most important part of doing a good reflection is that you're not evaluating or judging in any way. You're not even saying whether you agree or disagree. You're totally just centering the other person's frame of mind and what they're thinking about what they're saying. You're going to put your own opinions on the shelf for now. And I'm not saying that you're not going to share them or that you're not going to give advice. You're just saving it until you feel really, really good about the other person feeling understood, confident, and in control. So here's some examples. So if somebody said something like, "What's the point of even trying to get help? When it takes so long." A simple reflection would be like, "So you don't see the point." A complex reflection would be, "The waiting period is making you doubt if treatment will ever be available." Um, and a feelings reflection could be like, "You're feeling discouraged." Here's another example. "I'm tired of waiting for an appointment. It's taking forever." So the simple reflection here is you're tired of waiting. The complex reflection is it feels like help is never going to come. And the feelings reflection is you're feeling so impatient. And notice that when I do these, my voice is going down, right? So I'm saying it back. I'm not asking anything. All right, so that's reflections, and I really encourage you to give it a try. Um, Start at the what I call the shallow end of the pool. Don't dive into the deep end right away with something you've never tried before. But maybe when you get off of this webinar, you go talk to um, whoever you're going to talk to next, and they're talking about what they did at work today or some other situation that they're dealing with, and you just maybe repeat something back to them or say, "It sounds like, XYZ," and just see how they react, give it a whirl. All right, so the next tool out of the motivational interviewing toolkit is asking curious questions. And by curious, I mean something really specific. I mean something that you do not know the answer to. So you're not, this is not Law and Order. You're not cross-interrogating or leading the witness. You are truly trying to get curious about the other person's perspective and values. So here's some examples. You're really just trying to get people talking, asking questions you don't know the answer to, and that hopefully cannot be answered in 1 or 2 words. So if somebody said like, "Well, I'm not going to see that doctor again," you might be so tempted to jump in and argue with them and say, "You haven't even given it a chance. You only saw them once. This is the 3rd doctor that you fired," et cetera, et cetera. But instead, I really encourage you to just try getting curious. Well, what happened during that last meeting? Or what was your experience? Help me understand. Or what do you see as the pros and cons here? Like what would be good about going back? What would be bad about going back? So here's some ideas. Oh, okay, here's a poll. Let's try this. So, which of these is an open-ended question? What do you want to do during our time together? Or do you want to work on finding a therapist today? Remember, an open-ended question is a question that cannot be answered in one word. All right, so most of you guys got this one. What do you want to do during our time together is the open-ended question here. I always think of the do you or have you questions as like it's advice trying to like sneak in with a little mustache on, right? Like you are actually telling the person what you want them to do, but you're pretending that it's a question. And people are savvy to that and they are going to catch it, right? So try not to ask those questions. It can take some practice, but here's some ideas for how to transform your questions to be more open. So like instead of saying, are you feeling better today? You could ask people, well, what did you do today? Or what do you want to do today? Instead of saying, did you take your medication? You could ask, what's going on with medications? Instead of asking, are you going to call some therapists today? You could check in and say, how has that search for a therapist been going lately? Or what do you see as the pros and cons of, continuing to look for a therapist? I also like to ask people just what have you already tried in any situation? Because chances are people are trying to solve their own problems, even if that is invisible to us. We might not totally understand the ways that they're trying to help themselves, but if we ask, they can tell us, and we can give them credit, right? Like, oh, you've already tried a lot of things. All right, so we talked about reflections, we talked about open-ended questions, and now I want to talk about finding solutions because ultimately motivational interviewing is about motivation, right? It's not totally just about like being nice and exploring people's feelings. It is about trying to move toward change, trying to bring people along those stages of change. So again, I think a great way to make the pivot when you're talking about a dilemma or a problem is to ask them, what have you already tried? It conveys so much. I love that question because it conveys, it's open-ended, it gets them talking, it allows you to give them recognition for everything they've already tried. It allows them to vent, right? And it doesn't cost us one single dollar to be like, oh my God, that's ridiculous, right? Like we can offer that to people for free. So let them vent, let them talk about everything they've tried that didn't work, and say, wow, like and also it prevents us from giving stupid advice, right? And stupid advice means things they already thought of themselves. And it feels really bad to get advice to do something that you already thought of. It makes you feel like, oh, this person doesn't respect me. So avoid that by saying, well, what did you already try? Another way to try and turn that corner toward discussing solutions and moving toward change is to ask them, what could you try next? This is a nice question because, again, it's kind of a confidence booster. Like I'm asking them what they feel confident about, and I'm also demonstrating some faith in their ability to problem solve, right? I'm not just coming at them with a lot of advice and information. I'm asking them like, what's your next step? What do you think? What's your game plan? They might have a great idea, right? And then my job is easy. I don't have to say much. I might help them like think through their plan, like, oh, that's a cool idea. Yeah, when do you think you'll do that? Or, what do you need to do that? Do you need any support from me? but they might not need anything. I mean, I might just say, oh, cool, sounds good. Or they might not have a great plan, right? They might be stuck, or they might have bad ideas, or no ideas, or just be feeling overwhelmed. And if we've done a good job on offering reflections and asking questions, and we've gently tried to turn the corner into problem solving, then hopefully your loved one is now feeling understood, confident, and in control, and might be ready to hear your advice. So that's when you can offer your guidance. And I think the best way to offer advice is to label it and ask if they want it. So to say, oh gosh, yeah, you've tried so many things already. I can't believe you're still hanging in there. That sounds so frustrating. Um, I have some ideas. Would you like to hear them, or can I share them with you? And then they can say yes or no. But I think it helps so much to label your advice as advice, so that they can kind of brace themselves for it. Often people who are struggling with depression, if it's chronic, they've gotten lots and lots of advice over the years, and they might be prickly about it. So if we label it and ask permission to share it, they're much more likely to be in a good place to hear it. All right, so those are the three sort of tips and tricks I wanted to share with you from the Motivational Interviewing Toolkit. And we'll have a slide in a couple minutes about, giving, if you want to learn more, some recommended reading or some other things to check out. But let's just talk about the specific issue of the wait list, because I know that's why you're all here. And it sounds like, a lot of people here from Massachusetts, but from around the country, I'm imagining different situations, but frustrations all over the place with this. So to maintain momentum while the parents, like, you got to that kind of preparation stage, or maybe even action, like made the phone call or scheduled the appointment, but it's like 6 months away, or you have no idea when it's going to be. Um, maybe you're told, oh, 6 weeks, and now 8 weeks have gone by without a phone call. And you're like, oh, this is brutal. So as a caregiver, you're going to play that role of supporting your loved one during the waiting period. And of course, I think that you can of course, if the person changes their mind, of course, that's their decision and it's not your fault. There's nothing you did to change their mind. But hopefully your support can help sort of buoy them through that difficult period a little bit. So, some ideas that, we had when we were brainstorming of specific things that you can do for your loved one while they're waiting for that appointment, one thing is to just prepare for the appointment. So there's some really concrete things that you can do. So you can encourage them to help them organize their thoughts for their first appointment. I like to use my notes app on my phone before any doctor's appointment to just think about, like, okay, what do I want to make sure I ask? What do I want to make sure I address? Um, so you can help them do that, like, and just ask them, like, what do you want to make sure you tell them? You can help them make some notes about the history of the problem. You never know what the provider is going to ask, but I like to ask patients who I'm meeting for the first time, like, what is the issue that brought you in today? Is it a new issue, or is it a worsening of a previous issue, or was there some sort of new situation that made a previous issue intolerable, right? Like maybe you've been depressed for a long time, but it didn't really matter until you moved and now you're living with like all your in-laws, and it's like, oh my God, you really need some help. I also, if it's not your first time through this, I want to understand what helped in the past. That definitely makes our job easier, right? When you say, oh, well, therapy helped, or Prozac really helped, and then I went off of it. It's like, okay, let's do that again. Makes our job much easier. So you might want to write down sort of things that have and haven't helped, especially on the medication side. Um, I want to hear about how symptoms might be impacting you. Like, is this impacting your ability to work? Um, or to, meet up socially with people. And I also want to make sure that like I understand their expectations. Like, what do they want to get out of the appointment or the treatment course? Like, are they just here for a second opinion? Or are they hoping I'll be their therapist? Um, yeah, because people come in with all kinds of different expectations. Another thing you can do is just to kind of be present. And a lot of the things that a therapist or a doctor might ask them to do once they start treatment for depression are not rocket science, right? Um, a sleep schedule, getting physical movement, activity, exercise, um, eating food that is not just like, oh, I found this can of Pringles under my bed and I guess that's breakfast. Um, Seeing other people, interacting with human beings. Those are the kinds of things that once you meet with a therapist, that person is almost guaranteed to check in about whether those kinds of daily routines are happening. So you don't have to wait, right, to start those things. And the person might not be motivated, but you can use these same MI tools to talk about all of these things. Like, what are you doing today? Or what kind of exercise do you think you might be up for? Sounds like you've been really isolated. I have some advice. Can I share it? Like, I find that getting outside every day really helps me. Would you like to join me? Just using those same tools to talk through any of those issues. So you can help them with those things. Again, sleep, movement, social interaction, routines, any of that is going to be helpful for depression. And then, of course, it can really help to keep it light because I hear from my patients that sometimes their family members are like so intense. And I know it's from a place of love, right? But when you're like, every time you see a certain name on your phone, it says like mom, and that when you pick up, mom is going to be like, I love you so much. Don't kill yourself. It's like, it's too much, it's just too much. You can't handle that. You're already dealing with your own big feelings. You can't deal with mom's too. So another thing you can do to support that person who's dealing with depression is to really keep it light. Like send some memes, send pictures of the dog, send pictures of what you're eating. Um, send those like, Google Photos makes those like memories, like 5 years ago. Remember when we did this? Um, or just like have a set weekly check-in so that they're not like filled with panic when they see, it's 8 o'clock on a Tuesday and the phone's ringing and it's your name and they're like, oh my God, is it bad news? Or are they just like calling because they're worried about me? Like, I can't handle that. I know that I'm going to talk to this person every week on Sunday morning and that's expected and it's less stressful that way. Um, And then, there's other support options you can check out that are not like, these are all things that are not sort of insurance-based, fee-for-service, like the thing that you're on the wait list for. So here's some other ideas. Some of these came from me and some of them came from Susan and Ari, so I can't speak to all of them. But based on where you live, there's so many resources in your community. DBSA offers great groups that are online and in some towns in person. Ari recommended two of these mental health apps, How We Feel and Finch. I'm sure she'd be happy to pop on and describe them if anyone had a question. I really like to recommend Mightier. I recommend it mostly for children, but adults with depression might also find it helpful. It's like a video game based app, and it's a subscription based service. So when you're paying for it, they send you an armband and you get a login to the app suite. And the armband has a heart rate monitor on it, and it's like a biofeedback therapy tool, which is very cool. Of course, thank you for the comment. NAMI offers free support groups in all 50 states, such a good resource. Both the support groups and people who want something more structured can take like the family to family course. And then there's some great self-help literature out there as well. And of course, I mean, Al-Anon, tried and true, old school resource. I know so many people who benefited from that. If you want to learn more about motivational interviewing in particular, if you were picking up what I am putting down about these specific communication strategies in this shift from trying to tell people what to do to trying to elicit what they might want to do, here's some things you can check out. So this is my book. It's called The School of Hard Talks. Most of the case examples, the situations are sort of presuming that the audience is parents of teenagers and young adults, but it really doesn't matter. You know, you could be thinking about your adult spouse or loved one, and the skills are still relevant. They still apply. You just you'll have to use your imagination to stretch a little bit more. To make the skills apply or imagine how the conversations might go. But I think the book is an easy read and a helpful read. I've heard that from a lot of people. I also created an online free course about motivational interviewing. It's hosted on this site, handholdma.org, which is a website that was created by the Massachusetts Department of Mental Health. If you go to Handhold, you can find School of Hard Talks online, or you can just Google School of Hard Talks online and take the e-course. And then sort of the academic textbook that psychologists and counselors and social workers read when they're studying MI in school is called Motivational Interviewing, Helping People Change and Grow. It's a great textbook with lots of ideas. Again, it's more oriented toward clinicians, but I think anyone could learn from it. Thank you, Heather. It's nice to see your name. So another thing you can do, of course, is make a plan for a crisis. Hopefully you won't need your plan for a crisis, but you could consider talking to your loved one about a psychiatric advanced directive or like a RAP plan where they name sort of some of their warning signs and triggers, and you guys can have that conversation about like where they would want to go if they were really not feeling well. There might be certain hospitals or emergency rooms that they prefer, or maybe they have a strong preference about like, if I do have to go to the emergency room, I prefer that so this particular person transport me. I don't, under no circumstances would I go with this person. Um, thank you for the link to the RAP plan, a really useful tool. So, even though you think, well, a crisis is a crisis, you call 911, there's actually so much more nuance and detail to it than that. If you've been through it, you can, there's so many variables like how do you want to transport and which emergency room do you want to go to? Who would you want to bring you there? Is there any medications that are like hard stops for them? Like they've tried that and they had a horrible effect and they should never be on it again. That's so important to know, and doctors they don't know that, right? It's just not readily available information. And if someone's really not feeling well, they might not be able to communicate that super clearly. So it's worth writing down in advance. And of course, like if to name a power of medical decision making proxy, someone to make decisions on their behalf if they're unable. And then of course, like as a loved one, a big part of your job is just to keep hope. And as a therapist, as a psychologist, sometimes I say that out loud very explicitly in a session. I say, oh, I can tell you're feeling so hopeless. But I think you're going to get better. All of my experience and all of my training tells me that what you're describing, I know it feels really, really bad and hopeless, but from what I know, I actually think you have a great prognosis. I think you're going to live to see the other side of this. You're going to be feeling better in a month or two. And so as the loved one, you can convey a similar message. And I don't know what people think of that little speech, but I do give it from time to time. And I hope that it's comforting and not invalidating for people to hear that. Um, and then we have this little bullet here about considering your own self-care and wellness. That is like the smallest little sentence here, but I think it's honestly one of the biggest things you can do, right? Is to continue living your life as a caregiver. Um, because when people have depression, they feel really guilty. That's another symptom of depression, is feeling guilty and feeling like a burden and feeling like, everybody just takes care of me. I don't contribute anything. In the DSM, those are described as inappropriate feelings of guilt and worthlessness, but those are hallmark symptoms of depression that people feel. Um, and the last thing you want, it's not your fault that people feel that way. That's the depression talking. But the last thing you want to do is give them any reason to feel that way. So you want to make sure they know that, like, even though they're having a bad day, you're okay. Like, you're going to go out with your friends, you're going to go to work. You're actually having a pretty okay day. You wish they were feeling better. And if you can help them, you will. But their bad day isn't going to ruin your good day. They are not that big of a burden. Of course, much easier said than done. But like, work on it. Try and work on it to make that true for yourself, so that you can keep your own cup full, and continue to help your loved one. All right, so I'll hand it back over to Susan, and then I think we have time for some Q&A.
Well, thank you so much, Dr. Kline. There is like so many notes on my paper here, although I know that we can download the presentation as well. We're going to check back in with people, which is this poll that now I have ideas for how to keep my loved one motivated for treatment while they are on a waiting list. What are you thinking about that now that we've heard this fantastic presentation? So you all talk about that. I did want to point out a couple of things. Number one, if you want to learn more about the stages of change and things that you can do for the different stages, a couple of years ago, we created a video series about each of the different stages. So I recommend you go to YouTube and check that out. You can also find it through our website. I'm big on using the search bar, so stages of change. One of the clinicians that we work with for some of our programs says this thing about hope. And she says, I know it's hard for you to hold on to hope right now. So I'm going to take care of it for you. I'm going to hold on to it for you until you're ready to take it back. And I just find that like so reassuring. And so for what it's worth for you, feel free to do your own spin on it. But I don't know, it just choked me up. But I think that, as someone who has experienced depression, I think that I could have used that sometimes. So anyway, all right, let's go back. Good news, Dr. Kline. Everybody has moved up. We are with 56% strongly agree that they have some ideas and 44% agree. So yay, everybody. And yay, Dr. Kline. It's super important to us, as I said early on, that we hear from you all. So the survey link is there, and I'm sure that Ari is putting it in the chat as well. Again, one of you will receive a $15 gift certificate for Amazon. Not a huge incentive, but hopefully just enough that it'll motivate you just a tiny bit. I probably could have phrased that differently if I wanted to motivate people.
They can buy the book.
That's true. Anywho, so we're going to get to questions and answers. But Dr. Kline, there were so many practical tips. I am very excited to be sharing them with people and presumably trying them out in my life when I need to. Oops. Okay, let's do that. I would be remiss if I did not mention, we can't do this work without, and so we are very honored to have funding from many different sources, but for this program in particular, we're grateful to Takeda and to Johnson & Johnson Innovative Medicine. There are some companies that are corporate members, and they provide us with non-program specific support, which is a tremendous help. So for those, I'd like to extend thanks to Sage Therapeutics and Biogen, Takeda, Johnson & Johnson Innovative Medicine, Neurocrine Biosciences, and Alkermes. What else do I want to say? And for everyone listening, you should know that people like you make a huge difference in our ability to provide materials, to get new content created, to do all kinds of things. So if you are so inclined, we would certainly appreciate visit familyaware.org/donate to make a tax-deductible contribution. We are grateful. Thank you. We are going to turn to some questions and get some answers. So I'll be asking questions that came in with registration. And we didn't get a whole lot during the webinar, so get them in there, please. I'm going to stop sharing my screen for the moment. And here we are. Okay. Questions, questions, questions. All right. Well, you're probably going to think this is basic, but I am sure that many people will start off on the wrong foot when they're trying to do this. So, and they will go with writing or, whatever the thing is. But how do you correct if you've started off badly?
Of course you will make mistakes. I mean, not only is it, your family and it's impossible to communicate perfectly with your family, nor should you. You can be a human and that's okay. But if you realize that, mid-conversation, or even after the conversation, that the other person really was not feeling understood, confident, or in control, you could offer to redo the conversation and say, hey, I feel like I wasn't quite understanding you. Or maybe I was being too pushy. Or to say, maybe I was asking you to do something that maybe I was giving you bad advice, jumping in. It can be helpful to have a sense of humor. So many of the families I work with, I introduce these concepts and the caregiver says, oh my gosh, I'm totally a fixer. Right. And so using that language that's really fine, that's okay. I mean, that's probably why you're the main caregiver in this situation, frankly, because nobody else is doing it. But to use that self-awareness with the person who got upset and say, I always try and fix every problem, but maybe that wasn't the right approach. Can we try again? And just try and reapproach it that way. But really to take some ownership, I think can go a long way and say, even if it's just the tiniest little thing, I probably didn't take the time to really understand your perspective. Go ahead.
Should the people that should your loved one know about motivational interviewing? Should they know that this is what you're trying to do?
Yeah, that's such a good question. I think it depends, if they comment, why are you talking like that? Especially if you're doing reflections and you're bad at it, right? And you're just trying to you're repeating too much and it's inelegant and it's you're doing too many simple reflections where you're just literally saying the thing back and it's getting awkward. There's a part of the e-course there where the characters do this. I think it can be a lovely thing to be yeah, Yeah, like I went to this webinar, I read some self-help and it said to try this. Maybe it's stupid, right? Like, but just to acknowledge, like, I'm trying to be better. Like, I know that I sometimes do too much and get on your nerves. I'm trying something different. Um, what a model, right? To set for someone you care about who you're hoping that they might catch your motivation, right? Like you're gonna try something new, maybe they can try something new, and you can both feel foolish together. And that is great, you know?
Thank you. That's very good. All right. Getting an appointment for medication is easier and cheaper than therapy. Are there any guidelines on, or do you have any suggestions on when to encourage that option?
Um, so it's hard for me to answer that because it's very case by case. But the research suggests that both um, therapy and SSRI medications as first line treatments. I mean, I think it gets different when you're like in the weeds and the person has had depression for 20 years and they've tried lots of different things, and it's more complex. But when we're talking about like a first episode of depression, both work pretty well. They work especially well together when combined. But if you're having a terrible time finding a therapist and a prescriber is available tomorrow, like do it. It's a great way to start. Um, and then some people have personal preferences too, of course, like they really would prefer not to sit with a therapist and pay all that money and make time every week and dredge up painful memories. Like they like to just see if, taking Lexapro works. And it's like, that's great. Like that's a preference. Pursue it, try it. If it doesn't work, um, go back to looking for a therapist or try another pharmaceutical. But I think it's very true. I just want to validate that it's much easier to find an appointment with a prescriber, especially with the expansion of there's so many more nurse practitioners now practicing, especially over telehealth. There's tons of availability to see a nurse practitioner and get a psych prescription. Um, and therapy is harder to come by, especially in-person therapy um, with people who accept insurance. And a lot of that is just a time factor, like prescribing a medicine takes 15 minutes um, with like maybe a follow-up in 2 weeks and then another follow-up in 6 weeks. So like altogether, I'd say 45 minutes. With therapy, we're talking sort of a minimum of like an 8 session times 45 minutes commitment. So it's harder.
Yeah. Yeah. In some jurisdictions, some states, sorry, lawyer talk, um, physician's assistants can also write prescriptions. And so wherever you are, check and see what kinds of healthcare providers are authorized or licensed to prescribe for mental health conditions. So we're talking about people being on wait lists. How can a family member convey the level of need of a loved one to a healthcare provider? Like, we're on your wait list, but things are not going well. Does that make a difference?
I think it really depends on the practice. Mine, yes, it does make a difference, makes a huge difference. So um, I I mean, I can talk about it's only relevant to certain people, but like, oh, another point though to the previous question is really start with your primary care provider. Hopefully you have one, and sometimes they will do the prescribing. They manage tons of depression. They have a lot of knowledge about it. And that's where I work. I work in primary care, as the psych consultant. So, I, what happens is that the primary care providers, we see about 7,500 patients at the practice. If they're doing a well visit or if somebody comes in with a concern about mood or behavior changes, they make a referral to me. Sometimes my wait list can be long, it can be months. But usually I'll ask the provider, is this urgent? And that's where I think the input from family can make a huge difference. If you write, if you call into the practice and say, hey, this is so and so's family member, they don't need a release to talk to you. You can talk to them, right? They don't have to tell you anything. You can tell them whatever's on your mind. You can say, I'm worried about this person's functioning. It's really going downhill. They're not going to work. They're not going to school. They're sleeping weird hours. I'm worried that they're going to hurt themselves or they have hurt themselves. That that bumps you up my wait list. I can't speak to anyone else and how they run their practice, but that kind of information can be really helpful in sorting out urgent from non-urgent referrals. And yeah, people move up.
Well, you opened yourself up to this, but why don't providers want to talk to family members even when the client has given permission?
Yeah. So I like to get input from family members in the initial consult about what's been going on, what they've noticed. Especially I work mostly with children. Obviously, I want to get the history from the parent. Um, but even with young adults, it can be really helpful, or adult clients. Um, there is a certain, but then there's also like sort of, it's always helpful to get an email with an update. I think that I never turn away. I might only reply to say, okay, thanks. But that, or I might not return your call, but that might be, for different reasons. One is that I just want to make sure that my patient feels like this is their space. And even though, of course, they've signed for family, that it's okay for me to talk to family members, I might want to offer just a little more boundaries around the treatment. But I still welcome the input. The information is never bad to get. So don't read into it if somebody's not calling you back. They might still appreciate the email. They might just not want it to be totally reciprocal. Like I don't remember. I remember in season 1 of Mad Men, this is like a while ago, but it was in it's this drama set in the 1960s. And in season 1, there's the housewife, Betty, who's like seeing the psychiatrist. And afterwards he calls her husband, right? And like discusses the session with him. And of course that's presented as like this terrible, sort of sexist, infantilizing, portrait of how she's being treated. And of course, I would never want anyone to feel that way. And it's going to decrease the trust and the odds that they're going to come back and keep working with me. So I may be just sort of protecting their autonomy a little bit, but hearing about, whether they're taking their medicine or what you've noticed is often really helpful.
We always tell caregivers, don't expect a conversation.
Yeah.
Know what you want the provider to hear, say that, and then just expect that's the end of the.
Right, exactly. Okay, awesome. Thank you so much for calling, or thanks for the email. Thanks for the note.
So, as you know, we believe that depression can affect everyone in the family. How do you manage this difficult waiting period when there are children involved? Like it's the adult, maybe one of the parents who is really struggling, can't get an appointment. The other adult in the household is stressed out and trying to take care of everything. It's going to impact the kids. So what do you say to that?
Tough, very tough situation. I think a lot depends on like how old the kids are, but it might be helpful to tell them something about what's going on, because children um, assume everything is about them. So it can be helpful to tell them like, oh, mom hasn't been feeling well. She's not mad at you. She would love to go to your soccer game. She would love to be doing more drop-offs at school. She's just really not feeling well. Um, so helping them understand that. Um, and then also from the perspective of like the co-parent or the people who are stepping up, because the one parent isn't feeling well. For them to really just try and remember that like this is real, and the depression symptoms, they do wax and wane. And it's not that sometimes the person's being lazy and sometimes they're pulling their weight. Um, but that the symptoms can, like any other chronic illness, they can be worse some days and better some days. Um, and just to try and remember that that's all real and it's not, hopefully, not sort of an excuse or somebody just being lazy. I think also pulling in the support network, to the extent that there is one, can be really, really helpful. Um, like thinking about how would you know, just asking yourself, like, how would I handle this if my partner um, were ill with some other condition, right? If they were ill with cancer, or if they were ill with diabetes, if they were having a setback of MS, another chronic condition, right? Would I feel like not entitled, but like empowered to sort of call up the in-laws, call up the church group and say, can people help me? Can somebody drop off meals? Can somebody babysit? Um, and do those things, right? And not treat depression as somehow less worthy of help and care.
And I think that it's one of the things to also be mindful of is that it's probably making the depressed person feel even worse, that they're not being the parent that they want to be.
Mhm.
So I don't know where motivational interviewing comes in there, but I'm sure it does. Um, uh, there's a question here. How do you get someone with depression to seek help? But what they mean is how to get them to see that they can't solve it on their own, that they really do need some professional support.
I think that question, what have you already tried, can do a lot of work. And then you can offer a reflection like, wow, like you've tried so many things, and you're still feeling so bad. Like that must be so frustrating. So it's just those same tools, but used artfully, right? What have you already tried? What worked? What didn't work? And then, that can I share my perspective? Um, which is I wonder if, and also to like honor that like you it's not unreasonable what you did. Like it made sense to first try making, nutritional changes, and then you tried getting a new job because maybe it was like the commute or the boss. And then you tried um, going to the gym more often. Like those are all good things to try. Those are all really, really good things to try. Um, Smart choices. And what else? What stones have we left unturned?
Um, I hear the frustration in um, this question. What if somebody's been stuck in, what if someone's been in pre-contemplation for 10 years? I understand taking it at their pace, but many are stuck.
Many are stuck. Yeah.
I'm thinking one person in particular is stuck
Okay.
from the question.
Yeah. Well, I mean, the other thing is, so I used to work, my specialty was psychotic disorders. And I know we're here talking about depression, but I just want to touch on this because I think it's relevant. Um, One conversation that I think doesn't happen enough, is that we don't have our treatments, at least for psychosis. I don't know the statistics on depression as well, but for psychosis, our treatments don't work for everybody. And that's just a fact, right? Like you can go through pretty much all of the available antipsychotics, and either not get a great clinical benefit or or find that side effects are not tolerable. Um, and then what are we going to do? Blame you? Like, no, it's just you have a terrible disease we don't have a good treatment for. And sometimes people, I think psychiatry is, um, a field where we have a lot of good treatments, but also we don't have like we're definitely not at the end. You know what I mean? Like we don't have this all figured out. And I think that humility, at least for me, is a healthy and appropriate response to be like, yeah, this person seems unmotivated because nothing has worked. And that's not necessarily on them. Now, I don't know the question writer situation, if it's somebody who's tried a lot of different treatments and nothing worked, and now they're just like, I'm not doing anything. Or if it's someone who doesn't want to try anything, that is different. But
That's what it
that
sounds
can be
like.
frustrating. Yeah. And then I think the other thing is like I do this thought experiment with people a lot. And I don't know if this is helpful, but um when you're feeling hopeless, to just ask yourself, like, well, what if nothing changes? So I'm curious for the person who wrote that question, if they can ask themselves, what if this situation never changes? Right? Like, what if this is exactly the way it's going to be forever? Um, could I still love this person? Could I still live my life? And just play with that idea. Like, what would I do differently if I knew nothing were going to change? Because that can be weirdly helpful to stop kind of waiting for things to change and just assume they won't. If they haven't for 10 years, maybe they won't. And so, just something to think about.
Helpful, thank you. Not sure if this is a question. Well, here we go. What if the person you're trying to help feels like you're trying to shrink them?
I saw that question and it's honestly the best one because I don't like again, I don't have a great
We're
response to
not
it.
judging the
Like,
questions.
yeah, like I mean, it just means you're like not doing it super well. And it's a little clumsy, but again, like you're trying something new. And I think you can be transparent about that and you can blame me. Say, I went to this webinar and this lady made it sound like it was going to work, but obviously this is stupid. That's fine. I don't mind taking that particular bullet for you. Um, but I think that's why I really said at the beginning, I said, try this. Like when you log off, try it. Because I think you'll be surprised at how much people like reflections. People love it. And it could be about anything, but just try it. Like try doing a reflection tonight or tomorrow. Um, People are not going to look at you weird. They're just going to keep talking 9 out of 10 times.
It's good to know. Um, Please talk about the importance of connecting with others and thinking outside the box when you can't find care immediately. And if people have thoughts, be great to see them in the chat because I'm sure that everybody on this call has been in a situation where they've had to think outside the box and find some other support.
Yeah, and I'm not the expert in that, right? Because I am the help, right? Like I am the person who you're coming to see. So I would love to hear other people's suggestions of what's been helpful.
And we did have that slide that
Yeah.
talked about, DBSA and ADAA, and a person wrote in about NAMI, and there are some, self-help books, but I think the connection thing is really important for the caregiver so that they find some support and some relief, I think.
Mhm.
But if you can get your loved one to be connected as well, then I think that is I think that trying to get someone who is very depressed to take on connecting with others is a big challenge. because that's like one of the key things about depression. It's the isolating and just things feeling overwhelming in terms of being with other people. So I have a lot of respect for people who are able to support their loved ones through that. All right, we've got time for a couple more. How do you advise a patient unable to move forward in treatment as the guilt, of consenting? Oh my goodness, that's a little specific. I'm not sure that we can do that. When
There's a question up a little bit about some other types of therapy besides CBT. That I think is a good question, and maybe I can spend the last 2 minutes talking about that. So CBT, for people who don't know, stands for cognitive behavioral therapy, and it's a type of psychotherapy that has a lot of evidence for effectiveness for treating depression. The basic gist of it is that it's somewhat the theory is that thoughts, behaviors, and feelings all kind of are dynamic, and they interact with each other in lots of ways, and that we can help people feel better from depression by intervening on any of those. So even if we never uncover like the root of the depression, if we figure out behaviors that make somebody feel better and help them to motivate to spend more time doing those things, they'll feel better, you know. Or same with thoughts, that we have lots of chatter running through our head all the time, and but there are certain thoughts that might be leading to a lot of grief and upset, and bad feelings, and keeping people stuck. And if we can help them identify those particular thoughts, at least they'll learn to recognize them and maybe challenge them a little bit when they're occurring. Um, or we can try and intervene directly on emotions, like when you're feeling upset, like what are things you can do to cope. It differs from other kinds of therapies in that it is like more structured. So some people don't like that so much, right? Like they want to talk about um, the thing that came up for them this week, or something that happened a long time ago that's really been weighing on their mind. They don't want to talk about using their coping skills or identifying their automatic thoughts. And I think that's okay. I'm somewhat agnostic about it, actually. I mean, CBT has a ton of support, mostly because it's been studied the most, not because it's necessarily the best fit for every person. So I would say just keep trying to find a therapist who is a good fit. But there's also other things that can help a lot. Um, Exercise, going for a walk, going for a run, has a ton of evidence for helping people feel better from anxiety and depression. It really works. Sleep, again, is so powerful. And then sort of biofeedback tools, like I mentioned, the Mightier app, learning how to use relaxation in the moment to calm your heart rate, to use like deep breaths or meditation to feel better. It really works. So those are all things for people who are not, they don't want to sit around talking about their problems. Like they can work on those things. And those are great treatment options too.
Thank you. Therapy is work. So I can understand people,
Yeah.
maybe it's not the right time for it. I am just gonna try and make that share. Here we are, just so that people have the link again. But Dr. Kline, thank you so much. This was wonderful. It's going to be a great resource for people, and we're very grateful to you for lending your time and expertise. And thank you to everyone who stuck with us. I mean, we really appreciate you all coming to our webinars, sharing them, giving us your feedback on the survey. And so please complete the survey for us. Visit us at familyware.org and Thank you so much for coming.